Why do so many pregnant moms have back pain, hip pain, shoulder pain, neck pain, and headaches? I'm going to let you know right now. Hi, this is Dr. Lou Jacobs. I'm an expert in perinatal and pediatric chiropractic, board certified in that department. And I'm here today to give you a quick little talk that I gave over 23 years ago when I was an intern at Cleveland Chiropractic College. I was working volunteering at a midwifery center, and at that center I would go in and I would give this talk to explain to moms and their partners why they were experiencing the pain and discomfort that they were and how to deal with it. So I'm going to show you these old school posters that I made to give you an idea of what I talked about and to help you understand why the changes that occur during pregnancy can so easily lead to low back pain. This is a pre-pregnancy body. Good posture, standing up straight, spine is nice and curved, just like that. Everything is sort of in line and balanced. Now, most people don't have perfect posture before pregnancy, but it's more perfect than the posture when you're pregnant. And keep in mind, your posture needs to change. So these changes that look abnormal are actually quite normal for pregnancy, as you will see in just a second, but they do lend themselves to discomfort. So this is great posture right here, okay? And once pregnant and the baby starts growing, what we see are changes. Circa 1999, old school. All right, weight gain occurs. The baby grows, the mom gets bigger and heavier in the belly, okay, and pulls mom forward. At the same time, with the weight gain, the feet tend to flatten out. You hear about moms with swollen feet and larger feet. Part of that larger is the fact that under the weight that their body and their feet are not used to, the feet start to flatten out. As they flatten out, what happens is the feet and ankles roll inward and the knees end up rolling inward and knocking like this. And if you've ever been to the mall or a place where there's lots of people, you'll see people with knocked knees. And if you look down at their feet, you'll see that they're really rolled inward. The insides of their shoes right here may even be flattened out and smushed like this. As the knees roll forward, what happens is both knees roll forward. It causes a rotation of the thigh bone here, the femur, and a change in the position of the hip. This is the hip, and this is the ball of the hip, and this is the socket that it fits into in the pelvis, and it rotates forward like this. And if you put your hands on your hips right here, and you rock your feet back and forth, like your feet are flattening out, you'll actually feel the greater trochanter, this big bump of the hip here, you'll feel it move forward and back. But when it moves forward, it causes you to go like this. So not only is your pelvis and your hips driving you forward, but also the weight of the baby is pulling mom forward. And that requires, unless you want to stand like this, that you arc back like this to hold yourself up, engaging the muscles heavily in the low back. When you go back like this, you don't want to walk around like this, right? So what happens is you go forward like this to counterbalance the pulling back, you push forward. But that causes your neck and head to stick out like a turtle. Again, it's normal, but it creates problems. It creates tension in the neck. It can lead to headaches, shoulder pain, upper back pain, in addition to the low back tension and potential for pain down here, all because of the baby gaining weight your feet flattening out, your knees tipping in, and your pelvis rolling forward. And then when you add to that, towards the end of pregnancy, relaxin and estrogen, the hormones that are released to help the baby come out more smoothly by loosening up the pelvis, things can get pretty unstable down there. What's the result of all of that? As I said, this. Baby pulls you forward, pelvis and hips roll forward, low back has to arch more, upper back has to arch more to compensate, and then the neck and head come forward like this. As you can imagine, that is what leads to the problems. Now, is it safe to get adjusted while you're pregnant? It sure is if you know and you find somebody that's perfectly trained to deal with the issues of pregnancy. And for what it's worth, a lot of chiropractors have a lot of experience, and even though they're not board certified, they can take care of you pretty nicely too. As early as 1997, and certainly long before that, but in 1997, William Sears, MD, and his wife, Martha Sears, wrote, "It's our personal theory that chiropractic attention in pregnancy not only helps prevent or relieve back pain, but also can affect your labor by preparing your back and pelvic structures better to handle the stresses of labor and birth." So for decades, even in the medical community, it has been accepted and understood that chiropractic care during pregnancy is enormously helpful. These things are cumbersome. All right, last slide, if you will. Some authorities cite the incidence of low back pain during pregnancy at 50% or more. Okay, this is also an older article, or from an older article. Immediately after delivery, up to 2/3 of mothers may suffer back pain. This is from 1992 in the journal Spine, the leading spine journal in the world. Over 1/3 of pregnant women with low back pain report that it interferes with daily life. Also from the journal Spine from 1990. This is old common knowledge. And if you need help, or if you want to, one, set yourself up for potentially an easier labor and delivery, or if you just want to get out of discomfort during pregnancy, before the baby comes, but without the use of drugs and surgery, chiropractic very well may be the solution to your problems. My name is Dr. Lou Jacobs. I'm a chiropractor and acupuncturist here in Portland, Maine, board certified in perinatal and pediatric chiropractic. It is our specialty, and we are here to take care of you. If you have any questions, you can post them down below, and we will get back to you. If you would like more information about our office, you can call our phone number, which is 207-SPINAL-1. That's 774-6251. We're approaching 600 videos on YouTube, many of which are directed towards you, pregnant moms and partners of pregnant moms. So we encourage you to snoop around the website or snoop around our channel and search these out, find them, and learn even more about your body and the changes during pregnancy. All the best.